Have you ever felt trapped by your own thoughts? Like your mind is stuck on repeat, forcing you to do things over and over? You might not know it, but these could be signs of obsessive-compulsive disorder, or OCD. It's important to understand what OCD is and how it can affect a child's focus. OCD involves unwanted, intrusive thoughts, called obsessions, and repetitive behaviors called compulsions. People feel driven to perform these compulsions to reduce anxiety. These obsessions and compulsions can take up a lot of time and interfere with a child's activities, causing significant distress. I remember first being diagnosed with OCD. It felt like a huge weight, but understanding it was the first step to managing it. OCD can significantly impair a child's ability to focus at school and at home. A child preoccupied with obsessive thoughts or the urge to perform compulsions will struggle to concentrate on tasks, learning, or social interactions. One of the keys is distinguishing OCD from other conditions. Sometimes a child's distraction due to obsessive thoughts might be mistaken for ADHD. Similarly, slowness in completing tasks might stem from perfectionism related to OCD rather than a learning problem. So what can we do to help? The good news is there are effective treatments and strategies. Cognitive behavioral therapy, or CBT, is a primary treatment. It helps children identify and cope with negative thoughts by changing their beliefs and behaviors to ease symptoms. Another powerful therapy is exposure and response prevention, or ERP. This is a type of CBT where children gradually face their fears without performing the associated rituals. This helps them learn that bad things don't happen when they resist compulsions, which reduces anxiety over time. In some cases, medication might be an option. Selective serotonin reuptake inhibitors, or SSRIs like Zoloft, Prozac, and Luvox may be prescribed, often combined with CBT, particularly for more severe cases. Combining medication with CBT is called combination therapy and can help patients tolerate therapy. What can parents and caregivers do? Communication is key. Talk to your child about what you've noticed in a supportive, loving way. Listen actively and acknowledge their fears without judgment. Use clear, age-appropriate language to explain OCD and emphasize that it is manageable. Parental involvement in therapy is also crucial. Actively participate in your child's therapy sessions to learn how to respond to OCD symptoms. Coach your child through OCD symptoms and help them practice skills learned in therapy. Learn how to support your child's progress without giving in to rituals. Creating a supportive home environment can make a big difference. Establish clear and consistent daily routines to help the child feel secure and in control. Set realistic expectations, understanding that recovery is gradual. Offer praise and positive reinforcement for efforts to manage OCD symptoms, and encourage the child to face their fears gradually. It's important to set limits and avoid accommodation. Avoid participating in the child's rituals or changing your behavior to accommodate them, as this reinforces the OCD. Set firm limits on compulsive behaviors and be consistent in your approach. Education is power. Educate yourself and your child about OCD to dispel myths and misconceptions. Explain that OCD is caused by how the brain processes thoughts and fears. Promote coping skills. Help your child learn coping skills to manage anxious feelings. Encourage them to focus on their strengths rather than worries. Teach them to talk back to OCD by challenging unhelpful thoughts. Mindfulness and self-compassion are valuable tools. Teach mindful awareness, emotional regulation, and self-kindness skills. Help the child understand that having intrusive thoughts is common and doesn't mean something is wrong with them. Address any co-occurring conditions. Recognize and address any coexisting anxiety, depression, or disruptive behaviors. What about strategies for teachers and schools? Classroom accommodations can be very helpful. Consider seating arrangements to minimize distractions, like keeping them away from noisy hallways. Provide private testing rooms to reduce overwhelm. Allow the child to skip reading aloud if it causes anxiety, and provide extended time on tests and papers. Communication and planning are essential. Develop a communication system so the student can signal when symptoms are emerging. Be aware of potential triggers and give advance notice of schedule changes. Peer support can make a difference. Educate the class about OCD to promote understanding and support. Recognize that behaviors associated with OCD can be mistaken for ADHD or learning problems. Long-term management and support are crucial. Even after therapy is completed, maintain access to coping strategies and consider booster sessions if needed. Connect with local community services and support groups. The International OCD Foundation is a valuable resource. Recognize that OCD can create tension within families. and seek support for all family members. Finally, be patient. Overcoming OCD is a process that takes time and effort. Remember, you're not alone, and with the right strategies and support, managing OCD and improving focus is possible.